Well, this weekend marks the 4-year anniversary of Canada closing its borders to most international travel as COVID-19 swept across the globe, becoming a full-blown pandemic. The Canada-U.S. border was also shut down to non-essential travel a few days later. In the years that have passed, there have been plenty of research into how effective those closures were in keeping Canadians safe. For more on that, we're joined live by Mathieu Poirier, a social epidemiology professor at York University and the co-director of the Global Strategy Lab. Mathieu, thanks so much for being here.
Of course. Thanks for having me.
It's hard to believe that it's been 4 years. I remember back on March 16th, 2020, covering the announcement in this province as all the bars and restaurants were closing on the eve of St. Patrick's Day. Do you feel as though we've learned a lot in those 4 years?
Yeah, absolutely. This was really an unprecedented situation. The World Health Organization declared a public health emergency of international concern in January. In February, countries started implementing targeted closures, at first mostly targeting China. And by March, there were over 100 countries that had implemented total closures, stopping all non-essential travel from other countries. And since then, we've been able to do some research into whether these actually had an impact. But this was the first time that we've had such a large-scale policy intervention to stop the transmission of a pandemic threat.
And you're right, it was unprecedented. It seemed as though a lot of our lawmakers were almost grasping at straws with a bit of guidance along the way from some of the medical experts about what they should do to deal with this situation. So let's start back on, March 16th. That's when the Canada-U.S. border shut down to non-essential travel. Then a few days later, what did those, measures do? Were they effective? What did your study show?
Yeah. So our study actually broke things down into two levels, first globally and then within countries. We found that globally, the targeted measures that were only stopping travel from a couple of countries at a time really didn't have an impact globally. However, those total closures that were implemented very quickly in a row in March 2020 did slow down the pandemic globally. Within countries, the situation was a bit more mixed. Targeted closures did slow down transmission within countries. However, total closures were far more effective. And closures that were implemented early and that were more extensive were more effective at slowing down transmission within countries.
I'm curious if your study kind of distinguished between places, for example, in the U.S., where it was a state-by-state basis. Each state was doing different things depending on who their leaders were, versus a country like China, which essentially went into a massive, wide, large-scale shutdown, and then somewhere like Ontario and Canada, where we did a little bit of everything here as well.
Yeah, so this study really focused on the impact of the border closures themselves. And we found that any impact that it had on reducing transmission was temporary. So it was absolutely necessary to pair it with strong domestic public health measures to control the spread of the disease. Of course, actually figuring out when to implement these border closures was difficult because there was no evidence before as to whether they were effective, how to target if you were supposed to target. And now we have this evidence to rely on. So our recommendation is that you need to strengthen public health response, but also you need an organization like the World Health Organization to coordinate national decisions about whether to close borders, when to do it, and right now that's governed by a law called the International Health Regulations.
Yeah, there was a lot of discussion about whether the World Health Organization was actually effective in managing this pandemic at all. Your study, Mathieu, says that some of these closures were so disruptive that in the future they should only be used when absolutely necessary. Is there, a threshold that researchers have looked at as to when they should be activated in the future?
Yeah, that's such a difficult thing to judge, and that's why we say that the World Health Organization is best placed to help countries make those decisions. They have the expertise to be able to give that technical advice to countries as to when the situation might be bad enough that border closures are necessary.
What kind of research do you think should happen in the coming years to make sure that if something like this were to happen again, that there are less disruptive measures to regulate this as well as coordinating a more of a global approach?
Yeah, well, I think we need more research into the situations under which border closures can be effective, which domestic public health interventions they can be paired with, and which policy combinations actually work well together. And the situation we want to avoid is, for example, what happened when many countries implemented border closures targeting southern African countries during the Omicron variant during that rise, where we essentially dissuaded countries from openly reporting what was happening within their borders. And those economic consequences were severe. So we really want countries to feel like they can be reporting what's happening domestically and having this, again, international coordination of when these measures should be taken.
That's a great point. I remember it happening with South Africa specifically, and concerns about discrimination there with that variant. Mathieu Poirier with York University, thanks so much for your time and for breaking down your study for us.
Of course. Thanks for having me. And
happy COVID anniversary. I'm sure we'd all like to forget that as soon as possible.
Yeah.
Thank you.